Hello, this is Daniela from the Obstacle Doc, and today we're going to be talking about lower abdominal progressions and dynamic holds, as well as pelvic stabilizers. So when we are talking about lower abdominals, a lot of what we've seen already clinically is that there is maybe an anterior tilt or a inability to hold pelvic neutral through motion, whether that's with walking, running, or doing any kind of more vigorous activity for a long period of time. This can translate into pelvic pain, low back pain, hip pain, tightness, kind of tension, sharp, pointed pain in the front of the hip as well. So once we have kind of identified how to turn on the lower abdominals, we are going to progress just using them isometrically into with some motion. So Christopher is going to be laying down flat on the table here. We like to use the table or the floor to give you some tactile feedback so that you know when you're moving too far from the surface with the lumbar spine. If he starts to lift up at any point into kind of this tilt, so if he gets a lot of excess space underneath his belly, underneath his back, we know that he's falling out of the position that we want him to be in. So he is going to start by trying to cinch in those lower abdominal muscles. I like to cue thinking of putting on a really tight pair of skinny jeans or taking a really big, long exhale so that you feel the tension between the hip bones. That's your transverse abdominis. It runs from hip bone to hip bone, so across this entire space. So once you find that muscle, you should feel some tension underneath your hands if you do put your hands just right above your waistline. And then the first progression we can do is what we like to call leg slides. So maintaining this position, he is going to try to slide one leg at a time along the floor or along the table and come back in. Again, using that tension from the belly. If he slides out and he starts to lose this position, it's going to look like this. So you can see his ribs started to come up. He started to get a little bit more space under here. So if you turn this back on, you should see him kind of fall back inwards. So we can alternate left leg, right leg, going from one side to the other. This can be a great starting place. If you think of when you're standing, right, if you extend both your legs out, this is you in a standing position. If this is difficult, that's perfect. We can already start here, because what happens if you start to lose this is that in standing, you're going to go right into that position instead of tucked in and turned on. So this is the start of number one. So the second progression we can do is a march. So still keeping this all nice and tight, we can bring one knee up. So you're just floating that foot off of the table and then switching. Again, maintaining this neutral, this abdominal activation the entire time. What we don't want to do is lift up and immediately sag forward, right? We're keeping this still low. And then if this gets to be quite easy, you can lift and then extend out, almost blending the leg slide with the knee march. Good. And the entire time you're trying to feel the stability from the center of the body. Progressions from the little march or the leg extension can be a double leg hold. This can be really helpful for people who do any, yoga, group exercise, group fitness classes where you're doing leg lifts, V-sits, and you're really feeling your hip flexors. Now, while your hip flexors should be working to a degree, they should not be the primary driver for what is supposed to be an abdominal exercise. So how we can start is we're obviously going to turn this on first, and then he's going to grab one knee at a time into that knee hip flex position. So again, this should look like a familiar start if we're doing any sit-ups, if we're going to extend the legs into any V-sits. And just here, if we feel this is difficult to hold, that's going to be our starting spot. If he can maintain this, he can slowly peel away his hands. And now we're getting pure abdominal with a little bit of hip flexion on the side. So if this starts to feel really easy and we're not caving forward in through the abdominal wall, come back in. Now we can start to play around with an extension down from the heel, a march in this position, what we call your bird dog. So maybe you move an upper extremity at the same time. Again, the goal of this is to move with this being dynamically stable. For anyone who's pregnant or postpartum, getting your deep abdominals, that lower abdominal muscle, to turn on is going to be incredibly influential into any kind of pelvic floor recovery, as well as any kind of diastasis recti symptoms that you're experiencing, those coning, doming kind of things. Finding your lower abdominals actually in pregnancy is also going to benefit from any low back pain that you're feeling as your body starts to cave forward from there being a little human sitting on top of you. So one last progression that we can show you for the lower abdominal activation is with a band. This is going to be really good for any overhead athletes, anyone who does any kipping and swinging in a CrossFit gym maybe, who is experiencing low back pain, who's trying to get back to those really dynamic muscle ups, chin ups, things of that nature. So what I'm going to have you do is Christopher's going to grab the band, and I'm going to give some tension to this band so that he has no slack here. And he is going to maintain his lower abdominal activation, and then he's going to try to lift up. And even just holding here can be a wonderful starting point. If he wants to progress, he can do any of the things that we just showed, those leg extensions, double leg extension. Oh, so fancy. And then another level would be holding the legs and actually bringing the arms down. So this gets into a little bit more dynamic with the upper extremity, but now you can see him shaking. He has to use all parts of the core to keep himself stable.